Hey guys. Ooh, we got lots of open procedures. Lots of eaches. Those are going to be important. How's everybody doing? Hey Twinkle, how are you doing? Lots of eaches, lots of eaches. Oh my. There was something I'm on page 186, but there was something that I noticed this year on page, let's see, which one is it? 182 of the 2022 CPT book. I'm working on musculoskeletal. Look how some of these procedures start out closed and have a closed procedure included in it. And then some of them will start out open and have a closed procedure also in it. And then this one has an open procedure and then another open procedure inside of it. That's kind of cool. Closed and closed, open and then closed, and then open and open. So I really like doing the green, circling the green when it's open, and then circling the closed procedures. That way you're not having to figure this out during the middle of your exam. And when it says without something, I just draw a line through it. There's no reason to even see it there, because if it's not included, it's just not there. So that's what I did for those. But I moved on, going over here, and now I'm circling all these eaches because that's an important word. Doesn't matter what color you circle them, but I like to know if I'm doing an each thing or a plural thing. It's probably too much for you guys to worry with, but I like it when I'm teaching. How's everybody doing? We've had so many pass this month. I'm like, I wonder what is the pass ratio on those people that charge for classes. This one's without a free tendon graft, so I'm just putting a line through that one. Missed it, got above it, but then it has each tendon. Because I've had like 20 pass already this month of April. So that is crazy cool. I'm so excited about that. Usually I don't count, but this month being my birthday, I was kind of keeping count and birthday month. So some of them have been COCs and CCSs and CPCs. So that's been really cool. Really neat to see. And we're not done with the month yet. I got a lot of people taking their exam today and tomorrow. Hey, Go-Kart. Hey, Luna. Hey, Twinkle. Hey, Moms. Good to see you. Hey, Dawn. Toot or tot. See you too. Thanks for all the hearts. Tapping the screen. That's cool. Who else have I got here? Mo44. Is it possible to take this exam with going through the 2020 APC course? Yeah. You don't even need a course. And I think the course, it's okay. What you would use from that course is don't do the lectures, don't worry about the videos, and don't worry about the PDFs. What you need is the chapter review questions and answers, and the quizzes in the chapter answers for the quizzes. Those two things for each chapter, the quizzes and the exam review quizzes, I think they call it. The review is one set of questions and answers, and then the quiz is another set of answers that each chapter has, questions and answers. That's your bread and butter. Some of the CPT codes will be deleted. It won't be in your book anymore. Sorry. I'm drinking a juice. Miss Edwards has got me juicing. Today I've got cherries, grapes, green grapes, cucumber, bananas. So I'm sitting here digesting that. It is so good. Miss Edwards is taking her exam tomorrow too, so we'll think about her. Blitz is taking hers today, part 1. And my goodness, you can. You can absolutely use that course. That's fine. Don't pay for a course though. Good gracious. Okay, what have I got? Wendy. Hey, Wendy. I am new here and I'm just started studying coding. Do you have a YouTube for beginners? Yeah, sure do. I've got a YouTube. I do have a TikTok here that's about, I don't know, 6 or 7 TikToks back that says, "Where do I start?" That's the title of the video. Do that TikTok first and all the steps it says, and then start in on the YouTube videos. Yeah, just Google Medical Coding by Jen. I got a YouTube, I got Pinterest, Instagrammy, all these classes, I guess you'd call them, whatever I'm doing here on TikTok, Monday, Wednesdays, and Fridays. They're around 2 hours long, and I repost them on YouTube. So they're all there for a long time backwards. Sometimes I get a little talky, or my kids interrupt, or I'm not strictly coding or doing practice questions. So sorry about that. You do have to deal with me having a life in the middle of these lives and the kids and stuff. But I think it's a good value. You do have to sit through some of my stories, though, because I've been in medicine for a long time, since the 90s, and I've got stories about procedures or diagnoses or things that I've done that I share, which isn't really helpful. I don't know. I'm trying to associate so that my intention is, when I'm telling a story, is to get you to remember a particular situation that might be funny, but then you will always remember that CPT code or that diagnosis code that goes along with it, because, oh yeah, Jen said, she had to remove porcupine splinters from somebody and they use this diagnosis code or something. It's crazy. I got tons of stories that I'm trying to use, but a lot of people do not like conversations when they're learning something. They'd rather just have the info. So I do teach a little differently. I like to teach multiple tools that you can use, and I like to teach from the exams point of view, not from coding point of view. You've got a lifetime to learn how to code, and it will all change with each medical group or particular place that you work for, because everybody will code differently based off their contracts, and you will code differently at every location. And plus, it's not like the coding books or the courses are telling you now. Nobody has these books in their offices anymore. Everything's done on the computer. You'll type in keywords. It'll bring up your options. If you are, if it's wrong or won't go with their health plan or group, it'll give you alerts to tell you not to do it because you don't meet that criteria. It's pretty cool. None of it's done like the courses teach you now. This is just an older way to do it. So I like to cut through the red tape and just teach what you need to know from the exam's point of view to get your certification so you can get a job, and then you can learn how to code from there on out, based off their policies and procedures at their facilities. Because coding will take a lifetime to learn anyway. It's a lot of information, and you can't possibly learn it all you can get a good all around 80% to 70% in most of the sections within 4 to 6 months of prepping your book and practicing questions. And then there's room for a couple of sections that we just are not going to do well in no matter what, like lab and path, because a lot of codes are out of sequence. And then it's very difficult to learn those sections because those sections are not dealing with doing a procedure and coding that procedure. Sometimes it's based off of, it's based off a lot of factors, whether how the test is done, or how the results are presented, or how the specimens are collected. They could be the same test, but in different locations in lab and path, and they are done differently because of the way they collected them, whether they're enzyme or dual step. It's crazy. So we leave room in lab and path to, if you've got about a 50% in that during your exam, you're doing great. You've passed that section. So we bring up our other areas for sure a lot better. So I like to do the process of elimination, but it's not our only tool. I like to teach y'all the guidelines in layman's terms so you can associate those. You can get those codes and the guidelines moved to the codes that they're related so that it's there during the exam, since it's an open book exam. I also like to teach y'all how to look for coding irregularities, like modifier 52 won't ever go with usually an integumentary procedure. If we're cutting something off the skin, sub-Q, even muscular, we're not really reducing any services. I've not seen any answers come through that are that way. If we see that modifier and we're coding an integumentary situation or trying to find the answer, we'll avoid the answers that say modifier 52. Or in lab and path, I'll show you how to recognize modifiers that should be there, like modifier 91 is our lab and path code that you should be looking for. And if you see 2 answers with 91 and 2 answers without, then avoid the 2 answers without and concentrate on the ones that do have the proper lab modifier. And then that way it gives you a little leeway and ease, and at least we can get you to 50-50 shot on that one, if nothing else. So I like teaching little tools, little tricks, sometimes like from sections 1000 all the way through. They don't really pick diagnostic test as an answer. They have an anesthesia, but not really in these. If it's a difference between a diagnostic test, which is just a screening to see what's wrong with someone, versus an actual real procedure that they actually fixed and corrected on a person, usually it's the correction code, the one that actually is doing something instead of just scoping around and not really knowing what's going on with the body. It's more of a generic code. Same thing with the diagnosis codes. If it's a difference between a not elsewhere specified diagnosis code and then a real specified diagnosis that goes all the way down to the 6th or 7th character, and it's a 50-50 shot, normally it's the one that is specified. Things like that I like to help out with and train y'all to be able to see. Learn your difference in certain codes, like autograph. You got to think about that as you being in the driver's seat. You're driving. So that means that graft comes from your body part. Usually a lot of these fractures in the arms and legs, they'll go to your hip bone, that little cresty part, that's that big butterfly looking thing. They'll cut a part of that off and use that to help repair fractures in the body. So autograft means the graft came from yourself And then they have a word that's very similar that says allograft, and the U and the T is switched out with 2 L's. So I associate those with legs, and that means somebody went and got another body part from somebody else and walked it over to you, so that it is a donor body part. So you'll know the differences between a self or donor. So just little tricks like that to help keep things straight in your head during your exam. We've got 2 more autographs. I'm also circling words that are open in green and then closed in orange because it kind of looks red. So stop and go kind of situations so that we know the differences. I found that sometimes the CPT code descriptors have words in parentheses in them. Not every one of them does, like these don't, but this one does. And I find that those words are sometimes in the CPC exam questions, and more so than often than not, they are using these. And most people skip over them, and they're either looking right before it or right after it. And I'm trying to train everybody to be sure and highlight that area instead of what comes after the semicolon and what other people teach. I do it differently because I see more often the questions include these, especially if they have a proper name in it. Yep. If our procedure is like that one right there, unilateral, all I do is make a big old U underneath the CPT code. That way I know that if it's going to be a bilateral procedure, they usually tell you in the parentheticals right up underneath it when to use that modifier. So I mark it with 2 blue stars so that I know that if this procedure needs to be bilateral, we did both sides, I have it starred underneath there to use our modifier 50. So I like to mark those. I fix, oh my Lord, all of our red codes throughout the entire book to put down the page number where they're located, because a lot of times they give you a range and it could be 700 pages away or just right below, which is fine. But in the middle of the exam and all 4 of your answers are all 4 codes that are not where they're supposed to be because they're supposed to be in here numerically, can drive you insane and make you lose a lot of time looking for them. And all you need is a page number where they're at. I write the page number down and the column number because there's 2 columns. You don't even have to go that far. Just write the page number down. And if it's on the same page, I just draw an arrow. If it's down here, like over in this direction, then my arrow would be pointing more towards this way. If it's right across the hall, then my arrow's pointing that way. So anyway, that's what I do. I think that that's helpful during the exam because most of it is just a hunt for those CPT codes. All right, let's see. I do have a YouTube. There is a link tree in my bio here on TikTok. So if you go to TikTok, of course, and advertise, we'll go there. Go to my little bio, that link tree right there. Sorry, I'm getting the TikToks to come up right there. Link tree, it'll show you all the links to the Instagram, Pinterest, Notes, YouTube, Discord. Discord is the best thing. That's by far awesomeness right there. You download the Discord app from whatever app store you have, Apple or Android is fine. And then click on that link in my link tree. And what I've developed here is several rooms. This is our main chat room where we can all just talk in general. And Twinkle has announced when I go live, you'll be the first to know when I go live. We also help each other But when you back out and go to the 3 dots, you can go to practice rooms. You can go to exam day. Let me open up my thingy. I keep hitting the wrong thing. There we go. Nope. Come on. Plus symbol. I don't know what I'm doing. Oh, there we go. So I have all these different rooms on the sidebar when you hit those 3 little dots. In those side rooms, we have practice room questions, what to expect on exam day, E&M resources, CPT code resources. It's all free. ICD-10 resources. I post all kinds of stuff in here. Today I posted this page. It's like 606 in the 2022 CPT book, where they actually go through some laboratory examples in your CPT book. And if you were drawing labs to do meth and amphetamine drug screen on a patient, they tell you what to code and what the answer would be. And then they give you another one. What if you add cocaine to it and morphine? Then you would do that answer. And then they have another example and another example where they tell you what the answer would be. Those are super handy dandy for the exam. You could just go straight to that list on 606 and find your answer right here, and it tells you what to code, which answer would be right. So I love it. So there's tons of room, tons of help in that Discord, and it's all free. So we even have CEU help, job placement. You can see who all we've helped this month. We've had so many, like I said, we've had at least 20 this month, if not more, that we've helped. So that's so cool. I don't know how many teachers have that many pass in a month, but I'm really proud of that number. So even other certifications like COC, they're all listed here, and you can get help in each one of those rooms. Plus also join in on regular chat. And then we do have an off-topic room, which gets kind of funny down here, where you can debate what kind of sandwich cutter you are. So that's pretty fun. Betty and I are still going back and forth, and I think my cat even got involved in the conversation at one point. She's still grounded for that one. All right, now let's see what else we got in here. I just asked my psychic from TikTok if I was going to pass the CPC, and she said, yes, I will have 2. Have 2? Dawn, does that mean I will have 2? Or you will have passed? Or you will have to do it 2 times? Well, I could have told you that too. I know you're going to pass. I went to a psychic one time. Gosh, I was 20 years old, pregnant with my first child. I was in New Orleans with my mom on vacation. She took me to New Orleans. Don't go to New Orleans with your parents because no, don't go with your parents. Anyway, my mother was not shocked by any of it, and I was pregnant, but still I was shocked by it. It's just something you don't want to see with your parents. Anyway, we were down in some back alley of New Orleans, and this fortune teller comes out in the middle of the alley and gives me my fortune, and everything she said was true. And I did ask her, am I going to have a boy or a girl? And she said boy. But anyway, she was right. It was cool. Hey, Annie, how's it going? Fingers crossed you will be part of May's Pass. I hope so too. We will keep fingers and toes passed. I am always busy in the evening. I'm sorry, moms. But at least I got Mondays and Wednesdays lives posting now on YouTube. So let's see if they're finished rendering. Yes, they are finished. They are good. They are ready for you guys to start watching whenever you get a chance. I do random lives too in the evenings that are just book prep, where I go through and you can watch me do each code individually, prepping at the same time. Those are just random, but if you're part of our Discord group or Facebook group, I post in those rooms and let you know that I'm going live. You just passed your CCA today. Congratulations. That is 21. There seems to be a shortage in exam locations in New York. Yeah, Dawn, you're not the only one to have said that. It's really stressful. I know Miss Edwards is driving 5 hours away tonight just to get to a site and then has to drive all the way back. So I would have to do the same thing if I didn't take it online, if I was to do any of this all over again, because my testing site in Arizona is also 5 hours one-way drive there. Yeah, it's rough. You're welcome, Wendy. How long will you suggest one study before going to take the exam, because it's a full course, 2,000? Book prep is what I want you to do first. You need to get your CPT book. You need to go fix all this coding, missing an out of sequence code. You need to write the page numbers down. You need to highlight everything that is in a parentheses. You need to circle every time it says the word open or closed in procedures. You need to mark parentheticals that say when to use a modifier. You need to also mark parentheticals when it says do not use a code with another code. And I do that with double red stars, if I could find one. Here we go, like that, through the entire book. Start out with that. Do your uses with blue stars too, just like when you're using, they tell you when to use a modifier. If they're telling you to use a code with another code, then you need to have that down, because they're going to ask you something about one of those in the CPC exam. Once you finish all that, you need to mark your unilaterals and bilaterals for sure. And then you need to do one-word differences on CPT codes that start out with the same, the very same descriptors. Let's see if I can find one real quick for you that I've done yet. I have not done all of these yet. I've got to go back and do one more pass doing this. So these two right here. We've got open, open, treatment, treatment, distal, distal, radial, radial. It all says the same thing. The only difference is one is extra and one is intra. That's it. So you need to write extra there. You need to write intra there, so that when you're asked about those, you don't have to go word for word and find your differences. Some of them are easy, like this. Some of them are very difficult. There's an I one in the back that is just an outrageous. It's got like a paragraph, 4 or 5 sentences where both codes say the same words throughout all 4 sentences until you get down to like the 5th sentence and you find out one of them has an expander and the other one doesn't. It's crazy. So anything that starts out with the same words like that, go on and do your research ahead of time throughout the entire book and write that one word difference. That'll save you a whole lot of time during your exam. You don't have to research anything. You don't have to search the CPT code for what your differences are. You can just get to the codes, grab your 2 differences, do a search through the question. If we're extra or intra, it's going to be there. No matter what, it will be there if they pick those 2. And then you can find your answer without reading the test question, because I try to avoid reading questions at all cost. A lot of times the codes will tell me what the answer is without reading the question, so that's great. We pick the answer and move on with quite a few of them without reading a question, and that will save you a lot of time. The book prep will take you longer. Once you finish your CPT book prep, including going through and doing the anatomy pictures in the front of the book before you do the exam, you need to go mark body parts that they don't have drawn in. You need to add in the functions of things, like what is the function of our skeletal system? Well, it supports our body and protects our organs. What do bones do? What do they do for your body? Things like that you need to fill in and write in. The pink is those kind of bones. The green is those kind of bones. And then do your prefixes, suffixes, and definitions that you might not know of. Like the sesamoid bone is definitely on the CPC exam. Do you know which kind of bones are the sesamoid bone? Those kind of things. Prefixes, suffixes, common modifiers for this section are also needed on the very first pages. All that kind of information will definitely help you, especially for things like the male and female reproductive system. So all I do is just Google male and female, or whatever, female reproductive system, and then I put the function down beside every single one of their little terms right here. Like, oh, sorry about that, but the endofundal whatever, it's our little sweepers that sweep our ovums down into the during ovulation so that we can get pregnant. So you need to write down the functions of everything that's here, even the male reproductive system. And you can Google and look at images, and you'll find a million of these little things that'll tell you exactly what the function is of every little body part, and then writing that in. Super helpful during the exam for the anatomy questions. Once you finish all this book prep, then you can practice exam questions, trying to find codes. But the book prep will take you a while. So yeah, that's the roughest part. But it is an open book exam, and this book prep is super handy dandy to do before the exam. And while you're doing practice, whoops, sorry about that, messing with the camera too much. Get back to the screen. No, I don't want to end. I just want to get back to my main screen. There we go. Once you start doing practice exam questions, what you can do is you'll find words that will help you during the exam. So what I mean by that is there are words that they use in the CPC practice exam questions sometimes that you can add to certain CPT codes. Yeah, we know this is unilateral, bilateral, but they also call this an artificial vertebral. They added in a artificial body part. So that's pretty cool. It does say using a mechanical device. I don't know if they're being descriptive enough about knowing that they're doing an implant at this point, and that the implant is artificial. It's not from a donor or from your own body, but they are adding in an artificial body part. And that's helpful because it was in the question that was a practice question, and you can add that kind of information to the CPT codes. Let me see if I can find another one that I did up like that. It's super cool. So as you're practicing the exam questions, your book prep still isn't over with, but it's easier and funner this way, because when you're looking at the wrong answers too, you want to go back and not just look at the questions and pick the answers and then get to memorizing which answers go with which question. You want to go to every single one of the wrong answers and learn something about those codes too. And then that way you notice different things about some of the CPT codes. So I'm trying to find something else that I may have marked up. Oh yeah, we found out that this is cement in one of our practice questions, this polymethyl. That means that they're injecting cement in there. And then I added it to the CPT code, but I also added it to the drawing. So that's super cool. Sometimes you find out that kind of stuff just from the practice questions. So that's helpful. And we found out, and if you don't know a definition of a word, like this odontoid, Google it. That means you're in the neck. We're around cervical 2, right there. That's super helpful too. Because a lot of times, especially in neurological, there is one page where they have a lot of different neurological procedures, and they tell you the nerve they're messing with, but they don't tell you what body part that's in, whether it's in the shoulder, the hip, the extremities, or even in the brain. But if you go Google them, then you'll be able to write the body part, because those questions, the practice questions, will only say that they're doing a shoulder surgery. And if you don't know the proper name for the nerve that's inside the shoulder, you would have difficulty answering that question. So I tell you to go Google those and fill all those in with the proper names of, well, at least a layman's terms of where that body part is at. So that's what I like to help out with. And very much so. Congratulations for sure on passing that CCA. So it depends on how much you get done with the book prep. And then you need a good 4 weeks or so of practicing lots of questions, plus going to look and see why the answers are wrong. Practicing looking to see why they asked the question the way they did. Why did it get down to just 2 codes? Sometimes it's with a modifier, without a modifier, with a radiology or without. Those kinds of things are good to match up and realize that that's what the whole question is about. They just want to know, do I know where that do not is, or where that do is, or if I'm supposed to use a modifier. Like in cardiology, there is a good little paragraph here that if you don't know to do it, you might miss some of these answers, because down here on 249 in cardiology, there's this one little paragraph right here that tells you that all of these codes, and there's about 43 codes right there, and then there's a ton of individual codes, they already include radiology. If you go to those codes, the CPT code descriptors don't say that they include radiology. So when you're presented with a question during the exam, and some of these codes are like 20 pages away from that guideline, you're not going to go back and remember where that guideline is, and then in the middle of your exam be able to rationalize that that's got radiology in it if you don't do that book prep ahead of time and go on and go to each individual one and say it includes radiology. So that's what we do with the book prep, is get those guidelines to the codes, because your answers are going to be presented to you in just numbers, and you're just going to run from number to number. You're not going to be indexing anything. You're not going to be guidelining anything. You're not going to have time. You got 2 minutes per question so that you can save some time for those 10 cases at the end. So the time flies with every question. And the more you can avoid reading any questions, that's better. I like to go straight to the answers, look at those first, and then move on, if we need to the question. You guys, I'm freaking out because I want to pass my doc exam, but I don't think I can. Put it out there in the universe, Kim. I am passing. That's all. There is just no other way. You're going to pass. Don't say I wish. Don't say I'm afraid to. Just put it out in the universe. I will pass. And Jen's going to help me along the way. You got this, Kim. Chapter test, chapter review. Yeah, go kart. She's talking about a COC course or a CPC exam course back from a different date. I think 2020 or something. And she's wondering if she saw that course, would it do her any good? And I said the key parts are the quizzes and the review exams at the end. Grab those questions, practice those, look at every possible answer, find out why the wrong answer is wrong and why the right answer is right. Make notes next to those CPT codes. That's a beneficial part of your course. No matter if you're taking an old course or a new version of a course, that's good stuff right there. Thanks for saying it is good value. Oh, thanks, Dawn. Y'all are a blessing to me. You give me purpose. I like to feel useful. That's my thing. I like to feel useful. So if I'm not helping you guys, I don't feel useful. So that is helpful. Just take a deep breath, close your eyes, and say, I will pass. It's perfect, Twinkle. That's it. You put it in the universe. I am passing. Don't let any thoughts about maybe or not going to. I never even thought about ever not passing. I never even let it enter my head that I wasn't going to get that job, or I just knew I was. I just went and applied and knew I was going to get it. I had that. That's my job. Now, and then I also rejected their first offer and always asked for more. So I'm a firm believer in that's mine. I'm taking it. It's already done. Just put it out there in the universe. Annie, well, dang. Why are they so sticky about hiring if the computer does it all? I know. Well, you need to be certified. You need to make sure your doctor is clicking on the right diagnosis and the level of visit, because he's going to pick all that mess. You have to be able to review the chart and make sure that he can or she can code that correct level. The computer can't analyze the record. It can pick a code if you search for it, and it can pick a diagnosis if you search for it. But your job will be actually reviewing how many clicks are in there. If he reviewed 7 body systems versus just 3. Was there any history? No, there wasn't any history. Those kinds of things. You need to back up what the computer can't do and will never be able to do. It can't formulate that kind of information. You can always search and pick, but there's no way it can analyze that chart. And you may have to query the doctor, hey, you only talked about, like we had a question recently where a patient came in with thrush, but his blood pressure was 200 over 100. He said he was depressed. He said he was anxious. Doc didn't address his blood pressure. He didn't address his anxiety or depression and his stress level at work. And he just did the thrush and let him go, and then probably billed him like a 214 or something. It was crazy. So there's things you're going to have to stop for sure, because you have a brain and can think. So things like that is your purpose. Plus all the denials. You're going to get tons of denials from the insurance companies based off contracts. What goes through with Blue Shield won't be the same thing that will go through on Cigna. So you will have to be talking to your rep for your group to find out what is covered, what is your local determination, to see how you can code things. Some things will not be coded as post-op care. They have to be coded only with an E&M visit. So there's a lot of stuff for you to do. Don't worry. You're going to find lots to do. Is it hard to get a job with No, it's not hard to get a job at all, even with the A attached. Anybody that passes today with an A, you can get on at Optum Healthcare right now. They do everything from home. They will train you 100% and straight from home, and you can work for them for a year. It's contract work with no benefits, but you work for them a year, get that A off of your thing, and you're getting paid to do it and being able to work from home. Heck yeah, it's great. You know, it's better than being at McDonald's or anywhere else, you know, plus you're in the medical field, you're getting your year in, and then you can move on and get benefits and work in the office if you feel like it, or continue on with Optum and move up in the company, whatever you want to do. But no, there's no trouble getting jobs. Everybody's sick. You will never not have a job in healthcare, no matter what part of the field you go into. To get job with benefits right out the door with your A, I suggest you go on and get your risk adjustment certificate too. It's only one book. It's the ICD-10 book, and the whole test is on that one book. It's no more CPTs or HCPCS. Get that one because it is what all health medical groups are looking for, are risk adjusters right now. And that's a really good certificate to have with your CPC. And don't take a course. Don't spend a lot of money on it. Just buy the test, take the test. But yeah, that's your double whammy if you want to get in the job right away with benefits wherever you wanted to work. Oh, Twinkle Twinkle is amazing. Hey, Dawn, can you tell me the name of the marker you are using? Yep, highlighters. I use any push button because I like push buttons because I don't have to remember to keep the cap on. Just be careful that the highlighter isn't too wet, and sometimes you're highlighting a long sentence or a bunch of paragraph like that. When you are, make sure you're just lightly going over these pages because they're super thin. And if your highlighter is brand new, it could be soppy wet. And if it's too wet, when you go over it, it'll wrinkle because it got too wet, you know. So just be careful with the highlighters is all. But these are the ones that I've got right now. Thanks to, who was that sent these? She sent me like 12 of them. Somebody sent me some. Somebody that passed. Was it Auntie? Who was that? Somebody recently who passed in January, I think. And then my favorites of all times, of course, are the Sharpies Ultra Fine. I love these because I can underline and draw on them. It has to be the Ultra Fine. I don't know if my camera's gonna, there we go, Ultra Fine. Because it's thin and it starts writing right away. It doesn't seep through to the other side. Just don't put a lot of pressure. Just let it glide. And it won't smear. As soon as I write it, it's already dry. And I'm constantly moving my hands over these pages. And a lot of ink smears all over the place. But these don't. You can get them in push button too. Push button tends to be more wet when you get them at the very beginning, and they get a little too runny a little bit in the very, very beginning. But not too bad. Not too bad. It's just, they're just a little bit more runny sometimes when they're first brand new. I just leave them out and let them dry out a little bit. But I love the Ultra Fine. You can use lots of stuff. People use all kinds of stuff, but these are my favorite. After I've been working in these books and drawing notes in them since 2018, so it's just what I've decided I liked. You can also, once they do dry out, you can dip them a quick one, not even at 1 second, like a fourth of a second. You can dip them in this and they'll write again for another month. Just dipping them quickly in that. But they're really cool. But you can get these in Ultra Fine too. I think they say Ultra Fine right there, but it's super hard. Amazon has them. I don't have that in the link tree. One of these days, maybe I'll do that for you. But that's what I like. I love it when they tell us how to code things. Gosh, I'm on 157. They give you examples. If I have a posterior ortho, whatever, from L4 to S1, and we're doing an iliac crest hip graph, right? This is how we would code it. That's our answer. I love it when they give us examples and tell us the answers. Those are so handy dandy. And you can move those examples. Right now I'm on 22010, but this example is 22621. That code's going to be 40 pages away, which is crazy. But you take that example and move it to the code at the bottom of the page where you've got like a little room down here. And that'll help you during your exam. You'll have the correct way of coding that scenario. They have a ton of examples right here on this page where they give you the freaking answer of exactly how to code these scenarios. Love it. So look out for these words. And this one gets all fancy with appending the modifier 62 on them. So love those examples. Look out for those when they usually give you a set of guidelines before you start coding a set of codes, but sometimes those guidelines can be 10 pages away, and they have examples in them, so you can take that example and just move it straight to the code. Super handy dandy. All right, I got a ton of messages to catch up with. Yep. Ultrafine is the thing. Thanks, Tot, for saying Discord is awesome. What's the AKA for release? The AKA for a surgery of a release of a tendon? Good question. Release. Anybody got ideas? What's an AKA? I know manipulations, reduction, and there was another word that I put in there. The thoracic is your friend. Release of medical records. I'm getting all these HIPAA things coming up. Hey, PJ. Second try. You're doing your second try, Dawn. That's what the fortune teller told you. That's awesome. You emailed me, Coupon Cutie. I was just thinking about you yesterday. Your name was on my mind last night. And here you are today. She emailed me. That's awesome. I will go look for that. Let's see if I can find it real quick. That's so crazy. I was just thinking of you last night. Endorsement letter. Ooh, neat email. Yes, I can do my best. Absolutely. Katie. I got an email from Katie. Oh, thank you for all your content. Oh my gosh. Yeah, E&M is rough. Oh gosh. Alma. Yeah, she sent me videos. I've got to finish up on that. Oh Lord, Alma. I tried to download that program, and I got it to do transcription, that decoder or something or another. I got it to transcribe, but I don't know how to edit the video. Like, I want to make it a lot shorter. Like, I only want to do like 3-minute question, and I don't even know how to do that. So I'm working on that decoder thing, seeing if I like it and can purchase it for us. But Coupon Cutie, thank you. I hope I got the email. What's the difference between CPT and ICD-10? Well, ICD-10 is covered under HIPAA law. CPT is not, by the way. That's a good question that is on the CPC exam. Also, ICD-10 is your diagnoses, whether you have a mass, a lipoma, or anything, a procedure is the CPT code where we remove it, the actual surgery, those kinds of things. Yep, lots of people hiring CPCA. CPC is the most popular. Thank you for the roses, Cap. That's awesome. You just became my top #1 viewer. Wow. The screen is telling me that. Mo, you're welcome. Marge, hey Marge, second I've seen you again. Just buy her notes, it will save your life. Thanks, Marge. I'm sorry. I like to teach people how to do it themselves so you don't have to spend more money. I know y'all are spending a fortune trying to get through this and get this job. So I don't mind teaching y'all how to do it. But yes, I do have a page-by-page notes available if you want them. They are chapter-based, page-by-page. My website, Medical Coding by Jen, has some, and so does Etsy, but they both have size restrictions. I can only put up 25 megabytes per load in, which means some sections have 5 downloads. But that's okay. They're all there. It's just you have to get them section by section. Yeah. Hey, Miss Britton. Thanks for the follow. You're welcome, you're welcome, you're welcome, you're welcome. And does includes radiology mean that all codes that start with 700? Well, they are in the radiology section. So all the 7000s are radiology. These little sidebars are super helpful. So if you're in radiology, it will say you're in radiology on the little sidebar. Where's it at? There we go. We'll say it right there. And it does say 7,000. Sorry about my camera not focusing. But anything from that range is all 7,000. Yep. What percentage of people pass the CPC? Mother, they say 80% pass the first try. I don't know how accurate that is. And I don't know, but they say 80%. I've had 21 people pass this month alone. I don't know how many teachers can say that, but I'm super stoked about that. Hey, Go-Kart, you're welcome. Positive vibes. You will pass. Yep. Thanks, Mo. I'm not amazing. You guys are. You got to pass by 70. Yep. Somebody had exam H and sent me some info. So that's cool. What does the A mean? It means apprentice. Yep. Y'all are helping each other out. Can you do that anytime, or is it a job that a time to be online? The Optum one, I'm not sure. I'm assuming you need to be there from 8 to 5. I'm not sure if they work around your schedules. We'd have to ask Janet. She is our CCS liaison, who I helped pass something, and she got the job. She's doing CCS and CPC. Both certificates, but she got the job at Optum, and I think she helped other people get it too in our group. So I'll have to ask her if she had an option on what hour she worked, but you can find out all that information online, I'm sure. I am not amazing. You are, Mo. You too, Dawn. Going to Amazon now. It's like $12 with free shipping. It's great. Target has a 12 colors for $10 right now too. Yep. Dollar General tomorrow has a $5 off coupon. If you have their app, you click the coupon and you might be able to get the ultrafine there too tomorrow on a, I use them so much I make the marquee come off of them, their stamp of thing, but you might be able to get it tomorrow for even cheaper. Page 190 says release. Yeah, so if you have a pinched nerve or something that is stuck in something, then you may have to get it released. I have an old injury from July where I can't bend these PIP and MIP joints like that anymore, like these two fingers won't bend. I need to get the ligaments released in the because arthritis is already set up in them, and I can't through physical therapy get them to go down anymore. So if I wanted to go through the surgery and get the release done, it would give me more room to extend those fingers. It's just hard to hold pills in the hand because it leaves a little hole is the only thing. The other hand works perfect, but sometimes those repairs and revisions are done on those. All right, caught up on chat. Let's get to some practice questions. Let's see what these practice exams are going to look like. I was working on a video in this new little platform. Trying to figure this mess out, but it's hard to do it all. I miss Betty, guys. She's been taking some time off of social media, but she's fine. She's okay. Everything's all right. Little kid with a sore throat too, so she'll be back soon, I hope. And other than that, we've got lots of people tested today and tomorrow. Let me grab this so I can hide the question. And I can show you what I like to do with the exam questions. So the exam questions will come at you with the question on top and the answers down below. I like to switch them around and put the answers on top and the question down below. You can't do that during your practice exam, but what I recommend is taking an index card or fold a piece of paper and cover up your question. Don't look at it. It's full of propaganda meant to confuse you so that you do fail your exam. You want to avoid that sucker at all costs. So with this question, we're in our ICD-10 book, which is our diagnosis code book, which is what's wrong with our patient, which is covered by the HIPAA. So under this one, what do the T codes tell you versus the R codes? Meaning, is there a guideline attached to the T codes and the R codes? There's several. We want to learn a little bit about them. The best thing to do, hey Tammy, how's it going? Is to turn to the page and look at your strip beside them. So the ROO, if you can focus on the strippy thing, because I can't with my camera, it does not like to focus on a computer screen and then focus on books. It does not go from one thing to another correctly. So you'll just have to have out your book so you can see what I'm talking about. This is chapter 18, where the R codes start, and we're dealing with signs and symptoms. Yep, Shawnee's got it going on. Tammy, it's good to see you. So this is our first question of the night. You haven't missed anything other than me rattling on. The T codes are external causes. Our T codes are in chapter 19, which can be the first diagnosis code for patients, but if you happen to get into chapter 20, which are also external causes, but because they have the word morbidity in them, those codes cannot be your first diagnosis code. But anyway, these T codes can. And what we've got in looking at these, I notice that we do have the sixth character is different in every single answer. We've got 1, 2, 3, and 5. Even if you didn't know your guidelines attached to these, because every single answer is different and nothing is the same, you can find the answer without knowing your guideline, which is great. You just need to go to your T40. We'll run there real quick. T42. So if you're in the 2022 book, Lord help. All right, we're going to be on page 1153, bottom of the first column. So our T42X1, and you gotta love it, if you have the AAPC version of the CPT book, they green highlight your one-word differences. If they did that in the CPT book, we could save 40 hours off of our book prep work. I wish they did it there, but they at least do it here in the ICD-10. This is accidental. So whether you're taking your exam at home or in person, you can write on your test booklet in person. This is what I recommend. Write a little something down beside every answer so you don't have to go back to the book once you read the question and get confused and need to go back to the book. You've already gotten it written down beside each answer. You can write a full sentence or just whatever you need to know your differences. This is accidental. R2 is intentional. R3 is assault, meaning somebody hurt them. I don't know, a jerk. And then 05 is your adverse effect. So this is accident, this is a jerk, this is adverse effect, and this is intentional. Whatever it means to you, write a little something down. If you're at home taking your exam online, they allow you a dry erase board, and just write them in order as exactly they are in the answers. Write your ACC, your ASS, your AE, and your I in the same ABC order. Then you're going to search your CPC exam question, not read it. You're going to search for just those key words. I'm looking for accident, assault, like they hit somebody, they intentionally hurt them, adverse effect, or intentionally did it to themselves, like self-unalived or something. And so we just see here that the doctor prescribed it and they're taking it properly, and the patient just had a reaction to it. That is an adverse effect, and we know our answer is C. But to teach you something, there is a guideline attached to this. If a doctor does it to a patient, they prescribe a medication, the patient has an allergic reaction to it, something happens and they can't take it anymore and they have to intervene, stop the medication, do whatever. This one had a slow heartbeat because of it. That means we're always going to do the symptoms first and then a T code afterwards. If you do it to yourself. If you take too much of a prescribed or over-the-counter medicine, if you're doing too much recreational, ate too many mushrooms, too many brownies, you did it to yourself. The T code is supposed to go first, and then your symptoms go second. So that is a guideline that they normally ask on the CPC exam. You will have an adverse effect question, whether a doctor did it or the patient was an idiot or an alcoholic or, he was at a frat party, whatever. You'll need to make a decision. This one was easy because we didn't even need to go to the guideline. Every single answer was different, so we lucked out. It's like winning the lotto with this question. We could go straight to those codes, write a little something down, and then pick out the answer. Yeah, the insulin pump. Yep. That's true. Y'all are so good helping out each other. Ladies working on it. Yep. That's perfect info. Yep. E and M, and they're all the same with the same modifier. We ain't got to do nothing with those. Those are cool. Now, when I'm looking over here, what I'm looking for is similarities in just the numbers, just because they're numbers. So we've got all the same 9s, we got all the same 2s, then we have 2 that are 0, and these 2 are 71 and 72. They're super close. These are both 3s. The 25 and the 10 are farther apart than the 71 and 72 if I'm just looking at them as numbers. So I would go to 71 and 72 first, see what's going on with those codes, and see if anything matches up with my question, or if I have any directions with those codes that tell me not to use them, to use them, what the parentheticals say, whatever's going on with them. I like to know it ahead of time. Not just turning to the book in the back of the page and getting to those codes. That's not helpful. You really need to go grab that. Hopefully you've prepped that section and you already have looked at those codes, know what your one-word difference is. You can grab those 2 words and then do a word search through your question and see what your differences are. So one of them's a field. No, wrong. One of them's, they're both fittings. They're both of contacts. You see how these codes are when they both start out with the same wording. They love these types of questions. Fitting, of, contacts, lens. For, one of them's for treatment. The other one is for management. One of them's for a K word, diagnosis. The other one is for a surface disease, an eye surface disease. So we're going to look at our question, see what's going on with this patient. Make sure that your last question or the last sentence aligns with what you think is they're asking you. That's always important. Don't skip the last sentence. But we are dealing with dry eye. And one of those CPT codes, the 71, said ocular surface disease, which is just a fancy word of saying dry eyes, because your eye surface disease is dry eye syndrome. So what I did was, because of the CPC exam question, I went to the 92071 code, and above ocular surface disease, I wrote AKA dry eyes. I know we are dealing with dry eyes. I pick that answer and move on to my next question. Now, if y'all are doing this at home, I would look at the differences. Whatever that K word, KERATOCONUS, if you don't know the definition of it, I know I can't pronounce it, then Google it and write the definition up above it. 1 or 2 words that say what that disease is talking about. If you don't know what an ocular surface disease is, Google it. See what it says. It'll tell you dry eye syndrome. And then you can write it right above. I would go to also the 92325, you have this question and you have these answers here. Go look at them. See why they are the wrong code. 923. Where are we at? 25 and 10. 25 and 10. Cool. They're both parent codes. That's the first thing I notice. One of them is a prescription for contact lenses. The other one is a modification of contact lenses. So they're very different codes. And I would just underline or color code the differences. One's a modification. One of them is a prescription. Super handy to do. Then you've got 4 codes kind of worked up, and you've already seen these codes. You know the differences. You've worked them up in a question. And then if you do see them again during your exam, you'll remember, oh yeah, I've been here. One of them's a prescription. One of them's a modification. The other 2 are for 2 different types of diseases. So that's pretty cool. Good job. I'm glad you saw the prep video. Awesome. Immunizations. Immunizations. Our first code is the same for whatever vaccine. Then we've got a difference here. We've got 2 that are 58 and 2 that are 60. So let's go run to those two CPT codes, see what our differences are. 90658. Before we look at our question, 90658 is influenza. What's our 60? It's also influenza. So you'll just go one by one. Influenza, influenza, virus, virus, vaccine, vaccine. One of them is trivalent. The other one is trivalent. Awesome. One of them is split virus. The other one is live virus. That's our 2 differences between these codes. Now that we're here, you could underline the difference, or you can write that difference, 1-word difference, right underneath the CPT codes in that little white space right up underneath it, so that you have it and you don't have to go into the CPT code descriptor the next time you run here. You've got 1 live and 1 split is all you need to know. We're going to search our question for the word influenza and look for live or split. So we're just going to go until we see the word influenza, and we are doing live. That's all. Don't look at anything else. So we know we're doing live, which associates us with the 60. That means we are going to get rid of A and D. Then we're going to go to the next code, which is the same. We don't have to worry about it. Get that booger out of the way. All right. Our next difference is the 60 and the 71 code. Those are administration codes. We're no longer doing vaccines, but this administration code and the other administration code have 2 distinct differences. Anybody know what they are? What does the 60 mean? Thank you for the shares, too. There's 5 shares and almost 2,000 likes. Thank you, guys. Oh, look at Mean. She's lurking in the shadows back there. Good to see you. I was rethinking the Wednesday nights live and musing today over being able to get you on a couple of questions. I was still reveling in my glee-ness of trying to catch you on a question. Sorry, I'm never going to let you let that down. She's so hard. She gets every question right. So I'm sitting here basking in the glory. She is going to pass with like a 99% on her CPC exam. She's got it in the bag. All she's got to do is go get it. She is so going to pass. So that's okay. We don't worry about the add-ons. We're only going one code at a time in order of the way they're presented. We don't worry about what's coming after. It will only confuse you. So 60 deals with the physician counseled the patient on the side effects of getting the vaccine and also the risk of getting the vaccine plus the risk of not getting the vaccine. 71 means that there was an order for the vaccine, but no counseling was done. They can just get their vaccine and go on about their business. So we're going to search our question for whether they had counseling or not. I don't see nothing in it. Oh, it's administered by a nurse. So the nurse cannot do counseling. So if it's just a nurse visit, then that's all we need to know. We can get rid of our counseling answers. Plus the ×1 was stupid. That's probably what you were talking about. But C is our answer. Yes. And anytime y'all see an answer with a ×1 in the answer, that's never going to be a correct answer. That's a coding irregularity right there. ×2, ×3, ×4, yeah, those are good. ×1, that's just this code. There's no reason to hit ×1 by it. None at all. Hold on just a second. I'm going to yell at my kids to turn on the TV. Travis, turn it off. Travis, no. Why are you yelling at me today? And I'm working on it now. You can't wait till I'm done working. I have 50 people on there. I want to. It's inappropriate. They had the dance party going on. And I can't concentrate with some good music on because there's just too much going on. Can you explain colonoscopy with mod 52 and 53? I can try. Let's see. Yep. Okay. Discontinued and reduced services. So if we're doing a colonoscopy and we're going from the tailbone in reverse up the tailbone and up through all the large intestines and small intestines. And the goal is to get up to the cecum, right? So no matter what happens during this procedure, you will always code a colonoscopy. Even if you stop it, discontinue it, whatever, it's what the patient prepped for. It's what your intention was to do today. Don't ever down code it to like a flex sig or something like that. That's number 1 for your guideline. If you're doing a colonoscopy and the prep wasn't good and you had to stop before you got to the cecum, that's just a reduced service right there. We couldn't finish because of a reduced service. So that will always end up being a 52. Okay? Just because you couldn't advance the camera all the way through to the cecum because of an impaction, whatever, then that's just a reduced services. We don't downgrade it to a flex sig, which it technically is at that point, but we still code our colonoscopy CPT code. We just add the reduced modifier on the end. Now let's say we're doing a colonoscopy and we hit something. They have a huge hernia, a weakening in the wall we didn't know about, and perforated the bowel or hit an artery and had huge amount of bleeding and ended up pulling the camera out and then going to the OR for, because sometimes they do these in the doctor's offices. We may switch them to the OR and do an open surgery to repair that. That's a discontinued service. That's when there was something major that happened. We had to stop the procedure due to extenuating circumstances. The patient could even start having chest irregularities, their heart rate drop, some emergency happen, something. We had to discontinue the services. Earthquakes, power goes out, stuff like that. That will be your 53. For your discontinued services. There's usually a major thing that happened, and we had to stop due to your patient going to die on the table if you continue, or another thing happened. Heart rates dropped. They stopped breathing. You had to start doing CPR, whatever. Those are discontinued services. I hope that helps. I love his... I don't know what you love, Marge. Correct me. 52. Yep. As long as it wasn't due to the patient's current condition that forced them to stop. If you just couldn't advance the camera all the way, it's a discontinued service. Okay. Oh, his groan. It's like, oh, I never get to listen to music the way I want to listen to it. Yeah. You're welcome, Mean. Anybody got any other questions? Y'all stop me at any time. Happy to help. Happy to help. Anything y'all got on your brains. That's a fun one. They'll probably try to trick you on that on a colonoscopy. It's always a 52 when you're in the colonoscopy, and don't downgrade it to a flex sig. Whatever your intended procedure is, that's what you're going to code. Usually they're DC procedures where they stop. It's like the open heart or putting in a defibrillator, and the patient was on like a blood thinner, and they didn't let it reduce. You know, you got to stop that medication for so many days before you start putting, and before you open a patient, you got to stop their blood thinner medication. And some patients just don't wean off of it fast enough, like normal. Some people hold on to that medication in their body for way longer than supposed to. Who knows what the reasons are, but they'll start a procedure to put in a heart cath. And if they've been on blood thinners, they'll just bleed out on you like fast. So you can't do the procedure. You have to stop it and DC it. But most of the questions for the CPC exam, DCs will be in cardiology, and reduced services will be in the colonoscopy, GI stuff. Here I am repeating myself all over again. Lab. Number 1, guideline. Oh yeah, I keep needing to fix this. This stupid thing will not leave me alone about this wish list. So, I've earned, yes, I earned the roses. Thank you guys. So what do I do there? It won't get out of my way unless I put something else up there. We got plenty of roses, so what else do I put up there? May. Something in May. Okay. There we go. Whatever that is, it's 1 coin too. I don't know what it is, but I got to get it off my screen. Okay. So I updated the wish list so that it'll stay away from my screen. All right. Come on, camera. Okay. The number modifier that you use in lab and path, the 80,000 area, is going to be your 91 modifier. If you need to repeat a test within the same 24 hours, let's say you got a patient that comes in who needs a blood gas done every hour, of course the insurance company is going to be mad at you for billing 5 blood gases on the same day. Why would you do that? You have to tell them a reason, and that reason would be your 91 modifier. So if you see answers, some of them don't have modifier 91 and some do, more than likely it's a difference. That's what they're asking you about. Pick the answers that have the 91 and work from there. Anyway, this one's different, but what I do know is our OO, any lab codes with OO in them mean we're doing what, guys? One little thing you should know about lab and path, in addition to your 91 modifier, is what type of codes are those? When we see 2 snake eye zeros, you can always depend upon the fact that those are always, usually, a panel. Perfect, guys. That's awesome. Those are panels. They're a combination of a bunch of labs bundled together in a common bundle so that you can just code one CPT code instead of all 15 tests in it, like your OB panel, which does like CBCs all the way to HIV. Tons of stuff are all mixed in with it. So anytime you see the snake eyes, you know you're dealing with panels. So those are fun, easier to look at, and I think an easier section because they're all done with blood. You're not having to look for enzymes or what type of probe you're dealing with, if they're multi-step or not. It's just a simple panel. What you have to do in this section usually is determine if codes can be coded together, because if you're going to combine multiple panels together, like a CBC and a basic or a comprehensive panel, you can't repeat test if one panel already has a particular smaller test in it that's in both panels. You can't code those two together. You'll have to break it up and do one bigger panel that has more tests in it, and then individually pick out what's different in the other panels. So we're on page 598 if you're in the 2022 book, and common questions in this area are the basic metabolic panel and the comprehensive panel, and then also your electrolyte panel and your renal panel. It's a question about either combining the renal with the electrolyte or combining the comprehensive with the basic. And because those basic and comprehensive contain the same test in them, you can't code them together. So knowing that, our 53 is our comprehensive, and it's in a lot of these answers except for C. That's just crazy. It has a crazy amount of codes together, and it's irregular that CPC would ask you a question to code 1, 2, 3, 4, 5, 6, 7, 8 codes in one answer. It just looks ridiculous to me. The rest of them, the 3 of them, all have the same starting out answer. So we know this one is a comprehensive, so that's a comp. It's what I would write on my dry erase board or on the exam. And then the 47 is our basic metabolic panel. And that's the one that I was telling you can't code them together because the basic has carbon dioxide, chloride, creatinine, glucose, potassium, and sodium in it, which so does the comprehensive. If you're looking on that page, they do give you the individual codes for each one, which is lovely. So the only one that's different is the calcium ionized. On the other side, there is a calcium, but it's a calcium total. It's very different. Yep. So no matter what, we know that A cannot be the answer because we can't code those two together. Yep. So they're asking us if the doctor ordered, which happens every day in every medical group, every day, doctors order a basic and a comprehensive together all the time. It's just, they're like trained from med school to say those two words. And you know you can't actually go draw those two labs. What you would draw is a comprehensive, and then you would do that separate calcium that was ionized, which is your 82330, separate because it's the only thing that's different between those two code sets. They may ask you questions like which one of these is a example of unbundling, which would be C because it's all unbundled, right? Which two sets can you code together, like electrolytes and renal? Well, you can't. Everything that's in the electrolyte is in the renal panel anyway, and it would just be one code. So they may ask different variations, but this one is their favorite. And you will get asked a lab one about bundling, so just be on the lookout for it. One more hour to go. All right. Let's see how many more questions do I have. I got 13 more questions. So let's see if we can't get through all of them. So what would we do here, guys? What would be y'all's first step? What would be my ideal thing to do here? The question doesn't say calcium. It says a basic and a metabolic panel. And you need to know that those two panels, the only difference is the calcium. That was the part of the question you needed to know on your own. Go look at those two CPT codes. You'll figure out the difference. The calcium is listed differently in both of those panels. So you have to have out the book to see the difference. All right. Well, what I would do with this question is I would go look up my 52005, and then I would go look up also the 52332 because there's a division between these two. There's two that are this way and two that are that way. I would find out my two differences between those two sets of codes. Just search the question for that so that I could eliminate two answers and then get me down to a 50-50 shot for sure on this answer. All right, our 52332. Ooh, good Lord. 52. I'm slow at finding them all. 332. There we go, finally. Unilateral. okay, in our 5005. They're both cystoscopies. Good Lord. And they're both, one of them is with insertion of a stent. The other one, that's our 3-2. The other one is with irrigation. Is that it? It's a cath with irrigation. And the other one is a stent. So let's go see what we got going on. Are we doing a stent or a cath? We're doing a stent, and it's right there at the very bottom. Perfect. So we'll get rid of that irrigation cath. We'll keep with these two. So all we need to do is look at our parentheticals to see if this is a unilateral procedure or not. And if you look in your guidelines, which is right, it's not in your parentheticals, which is underneath your CPT code. The AMA wrote the guideline above the 52320, the second paragraph above it. They wrote the parenthetical way up there. And because it's an unusual spot for the parenthetical, that's why they picked this question and why they picked this answer, is because it's way up there. And your guideline does say for bilateral, for insertion of the indwelling urethra stent at the 52332, add modifier 50 if you're doing bilateral. It's just an unusual spot. It's way up there with the guidelines. That's why it's so important to go on and move those guidelines down to the codes. So on the 52332, I wrote in my notes right underneath the J, the double J type, there was a little room right there in white. I wrote, if bilateral, add modifier 50. That way I don't have to remember to go look up in my guideline up there. But then I would also go to, we were already there at our 52005. I would go on and see what my difference is between this one. We're definitely doing a catheterization, but we're also in the bladder, and we're doing a urethra cath. Our difference in this one is a stent. Are there any other words that could help me? This interpretation of a retrograde polygram, is that mentioned in our 332? Are they saying anything about a polygram or whatever? If they are saying they're doing the placement of a right and left stent with interpretation, but the CPT code descriptor doesn't say anything about this being a retrograde polygram. So it might be a good word to write around that too, because AAPC doesn't change their vocabulary. They might adjust the question, but they won't change the vocabulary. So I like to look them over, see what our differences are. Of course, our retrograde polygram is going to be associated with our 74420, which is our radiology in the back. And then I would go to my 74420 and associate it and add that code, the 52332, next to it. Say, if done with a stent placement in the urethra, okay to use 52332 next to it. That way you're putting your answers in both locations, just in case your question ends up being a difference between the radiology. Like the 25 doesn't go with this, it's the 220 that goes with this. So looking at all of this during your playtime, not during your exam, And matching up codes and writing it in both locations can be helpful too, just so you know. I'm going to move a little faster so we can get through some of these. What would y'all do for this exam questions? The ones that have been with me for a while. What would we keep? What would we get rid of? And we're just looking for numerical similarities. Yeah. B is out, and so is D. Yep, I would keep C and A simply because they're the same answer. And the only difference is my diagnosis code. So I'd run to the K4020 and the 90, see what my green highlighted one-word differences are. Which are what? What are our differences? Means I already got the answer. Are y'all sure about that 20? Y'all sure? I'm all like, yeah, because I did this one earlier today with a tutoring. Without looking at the question, are you guys sure? What's our difference between the 90 and the 20? K4090. After the J's, K40. I know a lot of times the 9 codes are non-specific, but K4090. Yep. And then our 20 is bilateral. Our differences are unilateral versus bilateral is our one-word difference. I just take it one code at a time. I don't think I'm quick enough as it is, but I just take it one code at a time. And I'm only looking for similarities. So because the same answer is here twice, but there's a difference between the second code, I know they're wanting to know, do I know the difference? That the 20 is bilateral and that this one is unilateral. So then all I have to do is look at my coding question and look for the one-word difference. I'm an auditor by trade. I do medical auditing. I have for over a decade now, well over a decade. I do have 20 years in medicine at least. I don't know, 1994 is when I graduated college. But if you count the 4 years of college, I got more medicine in there. But just been doing medicine a long time. But the auditing part, I never thought to take a course to learn to do medical coding. I immediately thought I need to audit the exam to pass it. So when I booked to take the exam, when COVID hit and I had downtime between audits, and people are always asking me if I'm a CPC, and it takes a long time to explain to somebody, no, I'm an auditor, I'm not a CPC, but yes, I deal with CPT codes every day. I just decided during my downtime that I would get the CPC so I could just end that conversation quickly. So my first thought was I need to audit the exam, see what I need to learn. So I booked the exam right away, went in person and just highlighted what codes were on the exam, which questions did they ask out of each section. I really audited the exam from the exam's point of view, went home, studied from the exam's point of view, thinking about what I needed to pass, scheduled the online exam, and passed. I'm just sharing my thoughts with you guys about how you could attack this exam from the exam's point of view and pass it. That's how I do it so fast. I'm not coding like indexing and verifying in the index. Oh my God, no, I'm not doing any of that. I'm doing it from the exam's point of view. It's weird, Marge, but yes, I'm the only one that I think does this. Can you do open and closed treatments? Yes, absolutely. I can tell you now what the differences are since we finished this exam. So let's check out our question. Let's see if we are unilateral or bilateral. So we're just skimming for the unilateral or bilateral word, or anything that says right and left is all I'm doing. I see left, left, left. Do we see anything that is right? Our route into the body might end up being right, but we need to make sure our procedure was only left. Does anybody see anything that says right? Left, left, left. I'm only seeing left. Sometimes it's super nice. They'll say, we're doing a unilateral blah, 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 but I only see left. They did say something about midline 2 times, but that doesn't mean anything with right and left. I know that's just garbage. Yeah, I don't see anything that says right and left. Yep, so I would pick unilateral and move on to my next question. A would be my answer. And write all over your book. You've got a quiz book that's going to be like this. Take a pencil, underline things, just like I am. Write on your answers. Look up the codes first before. Cover up the question. Don't peek at it, and go one code at a time in order. Don't look ahead. Find out what your one-word differences are. Write that down next to your answers. Then you know what to go look for, unilateral, bilateral. Yep. Thanks, Twinkle. Yep. They're being tricky. Oh, they got one on the end here that is just awful mean. In a minute. Anyway, A is your answer. Yes. So be careful. Sometimes the 9s are usually just, even the diagnosis codes are most of the time, 80-something% of the time, they're non-specific codes when they end in a 9. And we don't use those as an answer in CPC exam. If it's a difference between not elsewhere specified diagnosis code and a code that is specified as a good diagnosis all the way out to the 5th, 6th, or 7th digit, absolutely always pick the specified one that's bigger and out to the 6th or 7th digit. But this question actually has a trick on it because our 9 ending actually just meant unilateral or bilateral. So that was, and they know that. They know this is not normal protocol for diagnosis codes, that it's out of sequence. That's why they picked it. So a lot of this is just a psychological, am I paying attention to the one word difference in the question that's going to make a difference? And it just takes practice to notice those one thing differences. All right, next question. What would we do here, guys? What would Jen do here? Is there 1 or 2 that we would get rid of? I like your thought process. Yeah, it's rough. They didn't use unilateral or bilateral, and they're getting trickier with their terms. The one-word difference between those 2 CPT codes, they're trying really hard not to use that specific word now in some of their new questions. They're using very obscure wording to tell you, yeah, there is a difference there, but without trying to tell you what the difference is. I would definitely get rid of B. I might keep the OO up there, but usually that means a diagnostic procedure because it's the first one in the numerical sequence. So it probably is a difference between the 05 and 07. I would just go see what my differences are super quick. 52005. What is our difference? I have torn up this urinary section of the CPT book. Lord, it is just messed up. I got pages already falling out of it. It's a hot mess. 52007. I'm still trying to get there because my page is already falling out. All right. 5 is a baby code. So we have to go look at our mama code to see what our difference is, which is the 000. And then our 07, where's our 07? If I'm in the right place. No, I'm not. I'm not in the right place. Hold on. I'm going to get there. Lord help. It's been a long day. I started out tutoring at 7:30 this morning. Oh, sorry. I'm going to get there. 5200. The main thing is getting to the right codes before you start doing any of this. All right. Yep. Our 05 is its own mama code. Very good. And our 07 is our child code. Lord. All right. Our 07 is just with a brush. So it's kind of like a biopsy. They're doing a biopsy. So it's with a biopsy or not. So I like grabbing the child codes when they're all underneath the same header. That's easier to decipher than the mama code because it's got so much wording in it. So all we need to look for is whether they had a biopsy or not. That's it. So they don't say anything about a biopsy being in a procedure, but a lot of times if they did one, it would be down here towards the bottom. If they did any brushing, curetting, anything, irrigate in collecting anything and putting it in for anything, they did do a wash in irrigation. What do you guys think? We've got that radiology procedure listed again. Yep, it's a calf with a irrigation, right? And our 05 says with or without irrigation, and that's all they did. Did you see that word, the barbatage, whatever that is? I'm sure I'm butchering that. But in our 52005, we don't have that word in our CPT code descriptor with the word irrigation. But because CPC is using it with the pelvis was whatever was saline, that's our irrigation. I would put that word, the BARBOT, right over the top of the word irrigation so that you have it the next time you run into a question like this. You've got their fancy word for whatever they're doing here in the CPT code descriptor. That's handy dandy, I think. So we know we're doing the 05, which leaves D as our answer, of course. And we've got it right there. And any other verbiage that you want to go to, like our retrograde, is our 720, or 7 and then 20 is the last two digits. And look up the differences between the 00 and the 20 and just kind of note about them, write about them, those kind of things. We also have this answer and this answer in the same. And this was technically one of our throwaways at the beginning because we only kept the 5 and 7. And a lot of times I see that in one of our throwaways, the difference between the two that we're keeping is in one of our throwaways, which also leads you to the right answer too, which is kind of cool. All right, what would we do here, guys? What are we keeping? What are we throwing away? Bye-bye, B. Yep. And then is there anything else we would say bye-bye to? Bye to D. I'll play along. Let's go to 22 and 24. Go see what our differences are. Super easy. There's a reason why they pick these codes. So our T31, welcome back, Megs. T31 is our burns. We've got total body surface burns, right? So we've got T3122, 20 to 29. Just technically only needed the 29 to carry with us. Our 24 is non-existent. There is no 24. So that's cool. Our answer is 45. C doesn't exist. I know, right? And I got this from the 2022 questions, so don't know. What is our 42 that we got rid of? Because our other one doesn't, we've got third degree. Ooh. We've got second degree burns, but our CPT code descriptors are in just the third degree burns, so we can't count that. Which ones are our third degree burns? 20% third degree burns. So we're only looking for 20% third degree burns. We're not adding them all together. So our answer is only with the 20%. Right? Or 22? That's involving the third degree burns, total body surface, or 40 to 49 total body surface if we're adding them together. Yeah, you're right. 40 to 49 is that one. But that's together with second degree burns. But our ICD-10 code descriptor says only third degree burns. It's not a combo of second and third degree burns, so we can't say the 42, right? Does that make sense? Because our green descriptor says third degree burns, so we can only count the third degree burns. We're not adding the second and the third degree burns with those because we'll have separate codes for second degree burns, right? Somewhere else? If we're doing total body surface area for our body, I got way too much written all over this stuff. All of this. Second degree burns were 25. Third degree burns were 20%. What did they ask us? What is the code to report bodies classified according to the extent of the surface body burned? This one is third degree burns. 31. What's our 32? Oh, no wonder. I'm in the 25s. I'm not even at the right codes. Good gracious. No wonder. Why in the heck was I doing? I was doing 20. Don't even know what I was doing. Okay. T31, 22 is 20 to 29. Yeah, I was here. I have the red dots. Then we've got our T31.24, which is non-existent. Don't know why. Our T31.42 is 40, right? 40 to 49 total body surface, but only, it says in the CPT code descriptor, 20 to 29 of it is third degree. But this is total. This one, our T31.22, is the total body surface and the total for the third degree burns. It's combo for both those numbers. The 42 has two separate numbers in the code descriptor where it says the total body surface area was 40 to 49, which we're getting right there. But only third degree burn was the 20 to 29. So means correct. It's the D. What is our 3240? 42. That's corrosion burns. And our burn is from a burning house. It's not corrosion. Corrosion burns are like battery acid, those kinds of things, not fire flames. So because this one is corrosion, it's most definitely out. But there's two different descriptors here. If I show you in the book, it's going to not be able to focus anyway. But if you go to those two different diagnosis codes, the total body surface is 29 plus the total third degree burns is 29. In the 31.42, we have a total body surface area of 49, but only 29% of that is third degree. So that does make D our correct answer. Yes, chemical burns. Sorry about it being confusing. Sorry. I'm trying. It's good if you can see the code descriptors with me. Let me see if I can get the camera to do this. So our 22 says burns for the total body surface area is 20 to 29, but also 29% of it is third degree. The difference right here in that 42 is the burns are involving 40 to 49 total body surface area, with only 20 to 29 is third degree burns. So we have two different numbers in that diagnosis code, where the other one up here has the same number repeated twice. And that's our difference. That's what they want to know. Do we know the differences between that? That it has the total body surface area on top and then the third degree on the bottom. And then this one has the total body and then just the third degree separated out. So very specific codes. Hopefully that helps out better. Yeah, good. Yeah. Helps to see the codes, but sometimes my camera does not participate in that multi thing. So that worked out really good. Thank you, camera. Thank you, camera. And I am stumbling over the words. All right. A nice anatomy question. How much time do I have, Twinkle, while we're working on this one? Sorry. Anybody know what paracenthesis is? What are we doing? You can go to the CPT code and see what you're doing. What are we doing? 20 minutes more? Ooh, we got a vamoose. We are draining fluid. So if you go to the 49082, and if it doesn't have, and I think it just has needle something there, be sure and write drain fluid next to that CPT code so that you know what's going on. And E&M. So we've got a difference between 2 ER visits. What are you going to do when you have a difference between 2 ER visits and they're both underneath the same header? What's Jen's trick? We are going to write out an H. We're going to write out an E, and we're going to write out an M. We're going to see how many we have to have match out of these 3 under that header, which I think, if memory serves me, we're going to be 3 out of 3. We got to have all 3 match. So what we're going to do is go search our question and see if we can't find the word history, exam, and MDM, and we're going to write the CPT codes down beside each one of these that's going to be associated with what the description says in the CPT exam question. That way we can figure out if it's the 4 or the 3. We can at least eliminate 2, get us down to a 50-50 shot before we worry about anything else. So just search the question for history. What's our history level? Don't read the whole question, just look for the word history and then read the sentence before it and after it. Make sure, for sure, we are detailed. What code is associated with detailed history? Is it the 84 or the 83? Look at your 3 components inside those. Okay, we've got an 84. Perfect. Good job, Shawnee. All right, our exam is expanded problem focused. What CPT code is associated with that component? Is it the 83 or the 84? Good job, Mean. Perfect, Shawnee. Our MDM is moderate. Which CPT code is associated with moderate? Hey, Magpie. Oh, my kitty cats are starting to circle. They're hungry. Which CPT code is moderate? 84. Both of them are, Tammy? They're both moderate? Nice. All right. So, based out of 3 of 3, what can we code for this level visit? Are we going to keep the 83s or keep the 84s? Mean says 83. So does Shawnee. I wouldn't bet against either one of them. So, yep, let's get rid of A and D. So now our differences are just between these 2 medicine codes in the back of the book. And since both of our throwaways have the 51 in it, that's not being helpful at all. So we just got to go run to those codes, see what our two differences are. 99152. What's our differences? Means I already got it as B. 99152. 99152 is older than 5, and our 55 is younger than 5. So our patient being 4 years old, we can just go by the age of the patient and pick our B and move on to the next question, because we definitely can't code them with a procedure that is meant for somebody older than 5. So we know we've got the right answer. There's no way we could be wrong. We can move on to our next question. You don't have to look up all of them during the exam. Now, when you're not in the exam, I recommend looking at all the codes, figuring out why they're wrong, why they're right, picking out key terms that are in these questions, writing a little example beside all of them. If they call something a special procedure, if they say something, name anything as a proper name, I would add it to the codes for sure. Oh, where's my A? Let me get it moved down here. Formatting. Okay, there we go. What would we do here? What's our process of elimination? What would you keep? What would you throw away? Thank you, Twinkle. Yeah, I'd get rid of B and D. I'd keep the 67 and the 70. They're only 3 numbers apart. And go see what the 67 is really quick. So 965, if I can find the right code this time. Oh, Lord. Is that even in here, or is it out of sequence? 67, not 65. 67 is photodynamics, and so is our 70, but our 70 is an add-on code, right? Would that be an answer because it has the plus symbol in front of it? Yep, that's a coding irregularity. We wouldn't use it, so you don't even have to read anything. Just looking at these CPT codes would tell you what the answer is before you would even have to look at any of the question. That little plus symbol means that you can't code it by itself alone as an answer. It's a baby code that goes along with this one. So we would never code that one by itself. It will be a secondary code after this one. It would have a comma, and then you would put that code there. So we can pick that answer and move right on. Now, when you're doing these questions during your practice exams, go look at all the answers. See what your differences are. Write your one-word differences between all those answers and see if there's anything you can add. Pre-malignancy, destroying a lesion is all associated with the 67 code. If that's not in the CPT code descriptor, then write it down beside it. You've got plenty of white space around here. Write that they were destroying. External light was used. That it describes what that is. That will help you more than anything during the exam. Lab, lab, lab. Let's go see. They're all pretty close, but which 2 would you keep and which 2 would you throw away? Because you could do that with this one. Yep, they're only 1 number apart. That's the only reason I would keep them. So I would get rid of A and D. If nothing matches, I can erase these and go back to those codes, but more than likely, more so than not, it's going to be a difference between those two codes because there's a reason why. One of them's unilateral, one of them's bilateral, something's going on. One of them's dealing with the sperm and one of them's dealing with the zygote. Who knows? But it's something, and they want to know if you know the difference. 8, 9, it'll take me a while to get there. 8, 9, 2, 5, 4. It's not like I haven't looked at all these codes earlier this morning, but that was a long time ago. Whew. That was 13 hours ago. I've forgotten everything since then. So, we are dealing with zygotes. So we've got 8, 9, 2, 5, 4. This is floccular fluid. This is our FF. And our 55 is prep. Prep. So I would just look for either one of those words in the question. We've got our FF. We're identifying fertilization. What do you guys think? Yep. I would just pick my B and move on to my next question. But if y'all are prepping for the CPC exam, be sure and go to every single answer, find out what your differences are, write your one-word differences on all those codes, and then look to see if there's anything else you could add to this code. This 54, I would add that you're doing vitro fertilization here. And you're also using a microscope because some codes don't include that to identify the zygotes. So I would write all that included in on the 54. What are we doing here? For the process of figuring out what the answer is, 93303 I would go to, and then our 315. See what our differences are between those two codes, then look up the one-word difference between those in the question. Mean has 1. Our 3303 is our TEE, right? Something like that. Or is it our 315? It's a total. Thorax or esophagus. There you go. All right. Let's see what we're doing. We're definitely doing our O. Our O3. Yep, we can get rid of both the B's. Or both the 15s. I mean the B's and the D's. So then they're just asking us, do we know if this CPT code includes interpretation and a report with it or not? How would you know? A lot of times they do. Like if you go get a chest x-ray, you know you're going to get an interpretation and a report. But then again, sometimes they don't. That is all told to you in your guidelines. So if you go over there to the side where they have all the guidelines listed, and you look for your 99303 code in those guidelines, which is right on the next page before it, the 761 at the very top where it says echocardiograph. The very first paragraph gives you the guideline that they're asking about. And it says, the last sentence, when interpretation is performed separately, use modifier 26. They want to know, do you know that one guideline that's on a page before the actual code? And so since they said that, you need to move that information to the CPT codes under echocardiograph. So all these codes, if it includes interpretation, you need to add the modifier 26 to it. And you can add little notes to these about that. And then that way it's updated and you don't have to go back and look through the guidelines. The outpatient facility would charge a TC code for the use of their machine, but what we're being asked to code is the cardiac pediatrician's visit, and 26 is a human. That means a human did something special, and they get an extra bonus for that. 26 is human, TC is for a facility. What was I supposed to do? Open and close procedure? Okay, so I forgot about that. Somebody asked me about the differences maybe, or wanted me to do some questions about open and close procedures. I don't have any prepped, but I can do that on Monday for our Monday Live. We will not have your exams tomorrow, Jerry. Best of luck. Best of luck. Our little Saint Bernard, our little baby. I'm sure he is a big old slobbery hot mess. I'm sure you love every minute of that. Have you only got one? I'm just curious. Or have you got multiple? Because usually one's not enough, right? Best of luck tomorrow. Please relax. Make sure that you have your books already in the car. Don't forget to take, he's a big slobbery toddler. Oh, and he's your only. Aw, that's so sweet. Be sure and already put your books out in the car. Go on and lay out all your clothes, including socks and everything tonight, so you don't have to think in the morning. Already have breakfast made. You just warm it up. The less amount that you have to think for tomorrow is best. Have your AAPC number written inside your CPT book so you can't, because just in case they won't let you bring your cell phone in, you can't go look it up. Be sure you write it down. Be sure and bring your driver's license because you need to show ID to get your test booklet, and just shove everything in the car tonight. So all you got to do is be robo pilot mode, get dressed, eat breakfast, drive there, and go. The less amount of thinking is the same. Oh, and we also have a 10-month-old son. Oh my gosh. Bless your heart. He'll take care of both babies. Oh my gosh, you're going to come home to a mess, aren't you? You better call his mom to come over and help. Or his best friend. That would be even funnier. I left my dad in charge of my toddler one time. I come home and there's absolutely no steak knives in the house at all. They had taken them outside, and my dad had taught him how to throw knives and used our kitchen knives to actually throw knives into wood out in the backyard. He was 4. Yep. There you go with some more stories. You're going through a HEMA, but have ID, passport, Social Security, and the work badge ready. Go on and put those books out in the car, and you have a great, easy time tomorrow. I really hope for the best. Open and closed. Closed, are scopes. If they are sticksing you with little cameras at the end, like for gallbladder surgery and stuff, and they're visualizing your body parts with a camera, it is closed. Closed is camera. If they are taking that butcher knife that I probably can't draw, it's supposed to be a knife, a butcher knife, slicing your insides open and can visualize you with their eyeballs looking at the body part as they're doing surgery on you and will close you up with staples and stitches, then that is an open procedure. Sometimes your procedure can start out as a scope in some of their questions. You'll start out with a scope, but they're unable to do whatever the procedure is, and they'll transform it and turn it into an open procedure. So just be careful about that. Yeah, everybody's nervous. Neoplasms are a toughest subject. Then musculoskeletal. Yeah, just remember that if they're exploring the wound to check for depth, you're in musculoskeletal. Anything else, cancer-related, whatever, you're in integumentary. 11.6 is the CPT codes are cancerous, right? And then the 14s are non-cancerous. So 4s are non-cancerous, 6 are cancerous. Don't forget to bill your biggest procedure first. If something ends in like 32 and then the first code ends in 14 and you're in integumentary, that's a coding irregularity. You would never code it that way. The 32, the ending number, would always be the first code, and then the 14 would be the second code, numerically sequenced. So you'd be like 11332, something like that. I don't even know if that's a true code, but then the next code that would go after it would be 1114 would go after it. There would never be a 1114 as the first code. It would always be the 113. The bigger the number, it goes in first in integumentary. For pressure ulcers, we do the worst stage first. Yep. Absolutely. Just like with OBs and delivery, even if your vaginal baby was born first and you had another vaginal baby born second, then you had to do that last baby as a C-section. That C-section baby gets coded first. Always. Bigger the procedure goes first. Always. Bigger the ulcer gets coded first. Bigger the burn, always coded first. 3rd-degree burns are coded first, then 2nd-degree burns, then 1st-degree burns. How much more time, Twinkle? I don't know if I'm done or not. Oh, I am done. She said time. The practice test had a stage 1 right, then stage 2, and I was like, Make sure your stages are in the correct order. Some stages, the bigger the stage number, the lower the stage is. So it depends on how they're staging those sizes. So just be careful. I'm 2 minutes over. All right, guys. Well, I hope this has been so helpful. I will be back on Monday for another live here on TikTok, totally free. I posted 2 lives from Wednesday and Monday. They're on YouTube for today. I just got through publishing those, so you've got 2 more if you didn't catch Monday or Wednesday's lives. Those are posted. This Sunday is not a workshop, and there's no workshop next Sunday because it's Mother's Day. So our next workshop is going to be on May 15th. So if you want to participate with that, that's like on a Sunday. We'll start at like 2 o'clock, and I do about 50 to 70 questions back to back. I don't do any stories those days. And we just go from question to question, and I show you exactly how I would attack it just during the exam. I don't talk book prep that day either, so that you can at least see every single kind of question you would run into during the exam in whatever section I'm going over. Did we decide? I think we're going to do medicine on the 15th. So if you wanted to join in on that, you can book that on my website. It's $10 for 3 hours, and it'll be on the Medical Coding by Jen. If y'all have not joined, please join Discord. It's 100% free and so much information in there, guys. Tons of help and practice rooms for y'all to go to, no matter what specialty you're doing, even CCS, CCA, CRC, even CEUs, and all kinds of book prep and help in that Discord. Screenshots of my notes, all kinds of stuff is in there. Any info that I need or find that I want to help you guys with, it's all there. Plus you get to know when I go live with book prep. I'm taking the boys out to the trampoline park, let them run around and be wild tomorrow, but I'll be back with book prep tonight, working in Musculoskeletal. That'll be a live on YouTube randomly in about 30 to 45 minutes. And then I'll be doing one again on Saturday night, and maybe even Sunday too, because I need to get done with this musculoskeletal section, and y'all can work with me and do it. But there's no discussion about questions, but you can ask questions. But I'm working on the book prep, and y'all can work the codes with me if you want to. So check out YouTube. Be sure and subscribe, because that way you'll get alerts when I do go live on that. But other than that, I wish everybody the best of luck this weekend. We've already got like 22 people that passed this month of April. Y'all are really making my birthday month really special. So that's awesome. I wish y'all the best of luck, and I hope everybody passes this weekend. And I really appreciate you guys. No worries. Thank y'all, Shawnee, Go-Kart, Megs, Twinkle, everybody. I really appreciate you guys. And see you later, St. Bernard. I hope to hear about you passing soon, and everybody else, for sure. And if I have not replied to any of y'all's messages or forgotten about whatever I've promised, please remind me again. Please ask again. I'm all over the place, and I don't mean to forget anything or not reply. So please, please ask again. You're not bugging me. Just ask again, because I get pulled away in 10,000 directions and forget to go back. And I'm being reached out to in multiple places, so I might forget. And with Betty being gone for a week, I know I'm behind on lots of stuff, but I was trying to catch up today. Anyway, keep asking if I've forgotten something. All right, guys. I will talk to y'all later. Thank you guys so much. I appreciate all the love. Oh, almost 5,000 likes. Great. Wow.